Welcome to Psychedelics and Therapy, Addressing the Root Cause. My name is Danny Gillity, the Executive Director at the Eating Disorder Foundation, and I'm delighted to welcome everyone here tonight. Today's workshop is brought to you in collaboration with the Eating Disorder Foundation and Skylight Psychedelics. I'd like to share a little moment about the Eating Disorder Foundation. We're a nonprofit that was founded in 2003 with a mission to be an effective resource in the prevention and elimination of eating disorders through free and accessible education, support, and advocacy. We are a Denver-based organization that's now serving individuals and families both nationally and internationally. I want to thank everyone who made a donation upon registration. This is the way we're able to provide free resources. I will add the donation link if anyone feels inspired to donate tonight. So if you have any questions for our presenter this evening, I invite you to use the chat. We'll be leaving the chat open throughout the presentation, so please be mindful of keeping your questions appropriate and respectful of everyone using the chat feature. In addition, we're going to save a few minutes at the end for Q&A. So we're going to be monitoring the chat as we go, kind of keeping record of the questions, and then we'll save some time at the end to present them to our speaker tonight. We will not be sharing the PowerPoint. However, we're recording, so you'll have a chance to access that later. And now I'd like to introduce Judy Becker from Skylight Psychedelics, and she's their community and relationship liaison, and she will introduce our speaker. Thank you.
Thanks so much, Danny, and welcome to everyone. Dr. Lerman and I are really grateful for this opportunity. And thanks to you and the entire Eating Disorder Foundation team for all of your important work in this field. My name is Judy Becker, and I am the Community and Relationship Liaison at Skylight Psychedelics. It was a lucky day when I first met Dana. I was working for an eating disorder treatment center, and our conversation and the information that she shared regarding the healing potential of psychedelics gave me hope for those suffering with mental health challenges, including eating disorders. This hope has expanded to anyone seeking healing from the challenges of just being a human. There is so much to share about Dana beyond her impressive degrees and accomplishments, including her compassion, intuition, openness, and deep understanding. But this would take way too long. So for the sake of time, here's an abbreviated version of her bio. Dr. Dana Lerman received her MD at Mount Sinai School of Medicine in New York. She is board certified in internal medicine and infectious disease. Dana has worked as an infectious disease consultant all over the United States for over 10 years. During the pandemic, she identified herself as a wounded healer and began her own mental wellness journey. Since this time, Dr. Lerman's passions have shifted focus, and she has since received training and certification in psychedelic-assisted therapy from the Integrative Psychiatry Institute, IPI. Dana is one of the co-founders, co-medical directors of Skylight Psychedelics. She treats patients at the Skylight Journey Center in Evergreen, Colorado, and she sees clients virtually nationwide. As you can probably tell, I am a big fan. As Danny shared, there'll be the Q&A, but please feel free to reach out to me directly afterwards via email. And I'm putting my contact info in the chat now. And so without further ado, here's Dana.
Thank you, Judy. Thank you, Danny, both for the introduction. I'm Dana Lerman, as Judy had described, and I'm really excited to give this talk to you guys tonight. This is obviously a very passionate topic of mine, and also even more specifically, growing up as a child, I had family experience in the eating disorder space. So I really appreciate this time to connect with you. Danny's going to be helping me advance the slides, so we're going to just jump right in and get started. Who am I, and really why am I here talking with you guys today, discussing psychedelics? And, many people may wonder, what is an infectious disease physician doing in a psychedelic medicine space? And I think by the end of this conversation, you will know that I am walking my true path and I very much belong in this space. So I identify as a woman. My gender pronouns are she and her. I'm a wife. I'm a mother of 3 daughters. I'm a daughter. I'm a granddaughter. I'm a daughter-in-law and a sister. I'm also a friend and a coworker. I identify as being Jewish, and I'm Caucasian as well. And I'm a physician, like I said, board certified internal medicine and infectious disease. You can go to the next slide. I also identify as a wounded healer, and I didn't even really know what this meant until I was really midway through the COVID pandemic. And it was actually something that really resonated with me even before the pandemic. Many people who aren't in the field of healthcare don't really kind of, or can't really comprehend, because most of us in healthcare also can't comprehend what it's like to walk into a room of a patient who's suffering. And we do that all day, day in and day out. So when we are not taking care of our own mental health, we become wounded. And so the concept of the wounded healer was really something that resonated with me deeply. We can go to the next slide. So as we've been talking about, I was a frontline worker in the COVID pandemic. I did a lot of COVID consulting all throughout the country. I was actually flying on airplanes when most people were not allowed to go anywhere. I was on airplanes with my business partner, traveling and doing business risk mitigation for companies, helping places stay open. And through that company that I had developed doing that, I also ended up getting medical licenses in 49 states. So I was treating people all over the country. And I also ended up so I was working down at Rose Hospital. This is most of you are a Colorado-based group. So I was working at Rose Hospital, and most people don't know that Rose was one of the first hospitals to actually have COVID patients and be overwhelmed with COVID patients. So I was there in the beginning of the pandemic, even before we were wearing masks in the hospital. And once the cases at Rose settled down, I also went out to Los Alamitos, California, and I believe that's where this picture is from. I'm not sure. I think so. Los Alamitos, California, where they had an incredible amount of coronavirus cases, and the docs there really hadn't had a break in months, and there were morgue trucks outside, and it was just a very challenging environment. Some of the most challenging work I had done as a physician. So I was really in a state of distress working in these places. You can go to the next slide. So I really needed a change. I felt like I needed a change even before the pandemic, but being in this environment, when you're an infectious disease provider in a pandemic, you're not just a doctor when you're at work. You're a doctor all the time. You're a doctor to your friends, to your family, even to people who have no idea. You've never even met them. So people who you don't have a real relationship with, but they're a friend of a friend. And it was really hard for me to ever turn anyone down. And I just felt like it was my duty to use my skill set and help as many people as I can, or as I could. So it was about midway through the pandemic, I really started to hear a lot more and read a lot more about psychedelic therapy and psychedelic medicine. And it just seemed to be such an amazing, interesting field. And for me, I mean, I wasn't using psychedelics at the time when I learned of this. I had done LSD when I was 16, but then hadn't done anything after those experiences when I was 16 years old. And so I was really curious about how these experiences could help people in a therapeutic way. And so I ended up enrolling in a psychedelic assisted therapy course. And I took this course, and in the very beginning, there was Rick Doblin, who, those of you who don't know Rick Doblin, he's the founder of MAPS from 1986, trying to legalize MDMA for the treatment of PTSD, and really this big mover and shaker in the psychedelic medicine space. So Rick Doblin comes on and in the Zoom, and he says that he recommends that the people who are in the program, to really understand psychedelic medicine, he recommended that we have our own medicine experiences. And so these medicines were illegal. So I'm like, how is that happening? And it was just such an interesting thing to me. So I decided that I also realized that I had my own stuff going on. I had my own stuff as a COVID doc. I had my own things as a wife and a mom and all these things that I felt like this could probably really help me. So I decided to go and seek out my own medicine experience. You can go to the next slide. And I ended up at Rhythmia Life Advancement Center in Costa Rica. And so I got my vaccines and I felt like, okay, this is what I'm going to do. I'm going to go down there. And, I was really very interested in their COVID protocols and were they going to test everybody? And I was really kind of obsessed about that. And I was worried I was going to get coronavirus, but something kept telling me that I needed to go and have this experience. And I did. So we can go to the next slide. So this experience really changed my entire life. It changed my life as a physician. It changed my life as a mother, as a wife, as all of these things that I identify with. It changed. And it really, I feel like, made me more aligned and able to walk the path that I feel like I should be walking, and allowed me to really address my traumas and what happened in my life. And so we can go to the next slide. But it's interesting, a lot of people think that if you bring a veteran into a psychedelic medicine ceremony, that you're going to be dealing with all of the battlefield trauma. But oftentimes that's not what we see in a medicine ceremony when you have a group of veterans around. And this is the same thing that happened with me, is that it wasn't this wounded COVID healer physician that the medicine decided to work on first. I mean, so there was a little bit of that where my doctor, the doctor part of me, really battled the medicine. And it was ayahuasca that I was drinking down in Costa Rica. So this was an ayahuasca retreat. And for those of you who don't know, ayahuasca is a plant. It's exclusively plants. It's an all natural medicine. It's actually two plants that are mixed together. And one of them has a DMT component and one of them has an MAOI component. And you need the two together to have a psychedelic experience. And it's something that you drink. So down in Costa Rica, I drank this medicine and I had this huge experience where the doctor part of me, like I was saying, was battling this medicine and didn't trust the whole experience. It was like my Western medical brain could not allow these plants to come into my body and try to. Oftentimes people say that the ayahuasca goes into your body and kind of makes the medicine like its own diagnosis of you. It scans you for what it feels like is going on. And so my first night on this medicine, I drank it for 4 nights in a row. My first night on this medicine was a huge battle between me just not being able to surrender. So ultimately, once I did surrender, we can go to the next slide. Instead of this wounded healer, it was really my inner child that the medicine was working on and communicating with. And so this is what often happens in medicine ceremony. And when you have a psychedelic medicine experience and it is in a therapeutic environment and you show up with intention to heal and move through something, oftentimes you will have these kinds of experiences. And like I said before, it's not always what you think it's going to be. And oftentimes it brings you back to the root, back to your childhood of what happened. And sometimes we know what happened in our childhood, and sometimes those memories are completely repressed. And these medicines are able to help show us what happened. And sometimes it was something that most people would think is pretty horrible, right? Some sort of big trauma. And sometimes it's you got smacked on the butt when you were a kid and you didn't know why. And that shaped and shifted so many things in your life. So we can go to the next slide. That's me and my mom. So, a lot of people on this call and a lot of people that I talk to are wondering, if psychedelic medicine is really for them, or can it help them? Can it help someone that they love? And really the answer is most likely. These medicines, what we have to understand is that, the research was really booming before the war on, we call it the war on consciousness, but most people would call it the war on drugs. So the research was booming in the psychedelic medicine space, right? Before it was all shut down. But before that, these medicines, many of them have been around. I'm not talking about LSD, MDMA, but I'm talking more about psilocybin, ayahuasca, and some of the other medicines I'll talk about. These medicines are thousands of years old. These are ancient, ancient medicines. And, they're classified as Schedule 1 here in the United States and most places, well, federally, right? There's a Schedule 1 medicines that we're talking about, except for ketamine, which I'll talk about in a little bit. But, a Schedule 1 substance has to have no medical benefit and a high and have addictive potential. And all of us in the psychedelic medicine space know that that's not true about these medicines. These medicines have some of the lowest addictive potential possible. And so that's a really important part. And these medicines, for the most part, when they're used appropriately, are safe. So the question is, how can these medicines really help people? So we can go to the next slide. So like I was saying before, many of us in the psychedelic medicine space and beyond that, and many people in the field of mental health believe that all of these things that we suffer from as human beings, whether that's depression, anxiety, PTSD, OCD, eating disorder, addiction, all of these things oftentimes have a root, right? There is something that happened somewhere in our life that led to this, that led to that, that led to this, and led to that. And that, addressing these issues is what we really need to be doing instead of putting a Band-Aid on a wound. And so, a lot of people in the mental health space or a lot of people who suffer from mental health issues are on medications. And medications work maybe 15 to 30% of the time for people struggling with depression, anxiety, and these medications, their goal is to make people feel better. And I'm not saying that these medicines have no role or no place in mental health. I think that they can be useful as an adjunct for certain people. But I think it's really important to not just cover something up, because oftentimes when we do, we're not going to fully move through it and actually really feel better ultimately. And we're also likely going to pass it down to our children. And so that's something that we really feel like is important in terms of is kind of stopping the propagation of I don't even like to say the word mental illness, but these struggles, right? So really accessing kind of what happened to us, because there's nothing wrong with any of us. It's just something happened to us. And these medicines really kind of go inside and shine a light on what that thing was. So we can go to the next slide. So psychedelics are used and being studied for a variety of different conditions. Depression, anxiety, PTSD, OCD, substance use, suicidality, eating disorders, existential distress, end-of-life anxiety, and many, many more things. People are looking at psychedelics for long COVID, and that's obviously interesting for me. But it's really looking at also, one of the interests of mine is I had a client with Morgellons, or we used to call it delusional parasitosis, where a client often felt like they had parasites. And they would come into our office as infectious disease doctors because they would show up at internal medicine. Internal medicine wouldn't know what to do because they knew that it was a psychiatric issue, but they felt like they had to make sure it wasn't an infectious disease. So before the client would go to psych, they would come to us. And it was so apparent to us that this was a mental health issue, but that is rooted, it's so obvious that it is rooted in trauma, that something happened to this person somewhere along the way. And so it would be interesting also, just like all of these other conditions that we suffer from as humans, that's another condition that you would think that the person might benefit from psychedelic assisted therapy. We can go to the next slide. So when people ask what I treat with ketamine, because we'll talk about what I do at Skylight Psychedelics, but what we do oftentimes in the mental health space when we're working with psychedelic medicine is that, we are treating the human condition. We are helping people to heal and cope with the human condition. And psychedelic medicine is a very different space than traditional Western medicine. Traditional Western medicine is, I am the doctor, I'm on this platform, and I'm going to give you down there this medicine, and this medicine is going to heal you, and I healed you through this medicine. And psychedelic medicine is different in that we offer a medicine and a space and empathy and this empathic listening and this non-directive approach. We offer that to the person so the person can take the medicine and heal themselves. And that's the difference in this space, right? The person is healing themselves, not the medicine. The medicine allows you access to healing yourself. We can go to the next slide. So it's really important to know that psychedelics are not a magic bullet. This is not the kind of thing where you just pop a pill and then you're better. There's work involved. And when there's work before the journey, there's work during the journey, and there's work after the journey. And we'll talk about that more in a little bit. But, and sometimes your first journey might be really rough and you might hate it. And, it doesn't mean that the medicine isn't helping you. Because the way that I look at it is like there's this mountain of healing, and there's this staircase that's wrapping around this mountain. And each time you do more work on yourself, and it doesn't always have to be psychedelic medicine. But each time you do more work on yourself, you move up this step, right, towards this mountain of healing. There's no end to it, right? There's infinite things that you can do to improve your life and better yourself. But you can't go back down once you start doing the work. You can surely hang out on the same step, but and there are all different things, like all different types of therapies, right, that people can do, including psychedelic therapies that really help move them up the mountain. But people often believe that, and I believe that psychedelic medicines allow you to skip many steps. It's a faster approach to really getting at the root of an issue. Because a lot of us do talk therapy, right? And many of us are providers of talk therapy, and we know that clients get stuck. They're stuck there, and we want to help facilitate moving them through that space. Another thing, and Judy always hears me say this, that is really important, is that more medicine is also not always the answer. So if someone has a psychedelic journey, we can see this in the space of psychedelic medicine, where once someone enters into the psychedelic medicine space, then they become curious about all the other types of medicines. And then you can have people who jump from medicine experience to medicine experience without really fully processing their first experience. So that's something we'll talk about when we get to integration. We can go to the next slide. So I like to talk about this, psychedelic medicines can be a key to opening our baggage. So I like to think of it as that we always talk about, we have baggage, right? So everyone has a bag. Everyone has a bag of stuff that happened to them in their lifetime. And for most of us, that bag is locked up, and there's a big lock on that. And it's hard to get in that bag, and it's hard to take a look in there and see what it is that happened to us and work with it. But psychedelics you can think of as the key to opening this bag. And then the bag opens and you can look inside. And the psychedelics, that's all they let you do, is you look inside. But then it is your job and your work to take a look inside that bag, and then you start to work with what you see in there. What is that, right? In psychedelic medicine experiences, oftentimes we have a choice where we can see something difficult that comes up for us, and we can run the other way and say, get me out of here. Or we can turn towards that difficult thing and not only turn towards it, but we can approach it with an openness and a curiosity. And we can even express gratitude. And we often tell our clients, turn towards that darkness and smile and say thank you to the medicine for showing you this difficult or challenging experience, because that's what you need to see. Oftentimes in psychedelic medicine, we say the medicine always gives you what you need. Or we also say the only way out is through this experience. We can go to the next slide. And what's coming is going. That's another one of my favorite things. What's coming up for you and your processing is also leaving you, is going. So is psychedelic therapy for everyone? Certainly not. some people may not be ready for that, and you have to listen. You can't ever force someone into a psychedelic medicine experience. People have a knowing about it. They a lot of times people say that they were called to do this work, and you have to honor that as a provider. You don't ever want to push anyone into any kind of experience like that. Some people have pre-existing medical conditions that render them unable to take certain medicines, and there's different conditions that apply to different medications. And so that's a much more detailed conversation, but I just wanted to kind of give you a high-level overview. Certain psychiatric conditions, typically mania, schizophrenia, these are things that that we don't typically use in psychedelic medicine. They are looking at it from a research perspective, but in most psychedelic medicine spaces, we're not doing that. And certainly not active mania. There are some medications that can also interfere with certain medicines, and every psychedelic medicine is different. So it's really important that when you sit with someone who is facilitating a medicine journey for you, that they have thoroughly looked over all of your medications. There are plenty of ketamine clinics that you can walk into that don't really talk to you about the current medications that you're on. And there are some of them that can really blunt your response to ketamine. And so it's really important to have that conversation with the provider. And also obviously allergies. Some people can have allergies to psychedelics. And this is just a short list of really, who should avoid or indicate reasons why people wouldn't do psychedelic medicine experience. There's a longer list here too. We can go to the next slide. Oh, sorry, I didn't realize we skipped. Okay. So just this is an overview. There's a lot of other psychedelic medicines that are not on here. There's many that are indigenous medicines that are not very common in our society. So I'm not going to talk about all of them, but these are just a few of the ones that you may have or may not have heard of. Being in Western medicine societies. So ketamine is a medication that is a Schedule 3 pharmaceutical. It has FDA approval for treatment-resistant depression when you use it in the form of Spravato, which is a nasal spray, but it also has FDA approval for a very, very long time in anesthesia. So it's a very safe medication. It is being right now prescribed. We call it the Wild West of ketamine. It's being prescribed in all different types of environments. People are doing ketamine in a sterile medical practice where you go in and someone gives you an injection, whether that's in your arm, like an intramuscular injection or an IV injection, and they leave you in a room by yourself. That is one way that people are doing ketamine. There are also people who are doing it with a lot more intention and doing it in a supported environment with a ketamine-assisted therapist, someone who has training in this and can sit there with you on this journey and support you. We feel like that's a really important thing. And ketamine comes in all different types of routes of administration. So it's intramuscular, IV, it's an oral, a sublingual medicine. You can use it intranasally. And there are some other ways to use it that are much less common. Most of you have heard of companies that will send ketamine to be used at your house alone, unsupported. They give big doses of ketamine. So we get clients who come from those companies who were traumatized on ketamine, and we get them to come to us. And I'll tell you more about what we do at Skylight at the end, but we help them navigate those experiences by providing them with ketamine, but in a very controlled environment with their therapist. Psilocybin, it is a component of magic mushrooms or psychedelic mushrooms. You've probably heard a lot about that in the news. It's used for, back to ketamine really quickly. Ketamine is used for various mental health conditions. Really, all of these are used for various mental health conditions. Ketamine most importantly, is used for suicidality. So people who are having thoughts of suicide, ketamine is like this miracle medicine that can go in. And if you think about the suicide thought like this loop, it's almost, you can think of ketamine like this big scissor that goes in and cuts the loop. And sometimes it happens immediately after the first session, and sometimes it takes a little bit longer. But most people experience relief from suicidality with ketamine. Psilocybin is an all natural compound that is found in magic mushrooms. Like I was saying, it's used in many different healing ceremonies, but in our country, it is federally illegal. Psilocybin, it's been decriminalized in Oregon and Colorado and in various states across the country. But it's getting a lot of recognition for its role in the treatment of many different things, including major depression and end of life existential distress. MDMA is still is a Schedule 1 substance and still federally illegal, but we're looking for legalization of MDMA in a medical context to be used specifically. Right now, it looks like for the treatment of PTSD, but we expect that the indications for using MDMA are going to be broader. There are a lot of underground providers throughout our country, and especially in our state, who are working with every single one of these medicines on this list. And we'll talk about, I'm very big into harm reduction, so it's important to talk about at some point in this talk, really how to vet a provider who's maybe doing some of these underground ceremonies. And MDMA is also a street drug. The street form of MDMA is ecstasy, Molly, that people use and abuse, and it can also be tainted with fentanyl. So there's a big push for testing. DMT or 5-MeO DMT. So these are medicines that can be either made synthetically in a laboratory, or 5-MeO DMT can be expressed from the Colorado River toad or the Sonoran Desert toad, Bufo alivarius. So these toads are caught, and their glands are expressed, and they secrete this 5-MeO, and they dry out the 5-MeO, and then they kind of scoop it up, and it looks like mica almost, and it's often smoked, and that's how people can have a psychedelic experience. And all of these medicines also have different durations and of onset and durations of how long they last. And 5-MeO is one of the experiences, and so also DMT is that it can be relatively brief. It can be 5 minutes to 45 minutes, where MDMA is usually 8 hours, psilocybin can be around 5, and ketamine is typically an hour or less. Then we can go to my favorite, my medicine of choice, which is ayahuasca. And ayahuasca is typically a very long experience, over 5 hours, and like I said, it's a combination of 2 different plants that people drink, and in healing ceremony. But there are all different types of people doing all different types of things with these medicines, and a lot of them are indigenous medicines like ayahuasca and ibogaine and psilocybin. And it's really important. We feel at Skylight it's very important to honor the indigenous roots of these medicines, and to not serve these medicines until you feel like you have proper training and can honor where they come from. Iboga or ibogaine. So iboga and ibogaine, for those of you who don't know, is from a shrub in Africa that's been cultivated by the Bwiti tribe. And it is typically used for opiate detox, ibogaine, and it is wildly helpful for people who struggle with addiction. And they're also using it for people who have traumatic brain injuries. And ibogaine and iboga is really used even beyond the addiction space. Like there are Navy SEALs who travel down to many places down in Central and South America and have iboga experiences, and then come back to the United States because they're dealing with their trauma. LSD is also on this list. It was developed in the 30s and had a lot of promising results when initial trials first started, and then all got shut down like all the other ones. But then the LSD is really being studied now, and I was recently on a study looking at LSD in the treatment of generalized anxiety disorder. So yeah, these are this is just a brief kind of overview of these medicines. I could talk about this all day long, and I would love to if anyone wants to continue the chat afterwards, but we can go to the next slide for now. So something that a lot of people hear about in a psychedelic medicine is the importance of set and setting, and set really refers to the mindset in which you go into this experience. And setting is referring to the environment that you're in, right? Or this healing container, or not a healing container, that you put yourself in when you are doing psychedelics. We can go to the next slide. So there are a lot of people who decide to do psychedelics and will take it at a concert venue or something like that. That's not something that we recommend. I mean, there are plenty of people who do recreational psychedelics, but in these settings, it's more likely that you can have an issue with what people call a bad trip. And I'll talk about the different types of trips in a little bit, but you're more likely to have a bad trip if you're in an environment that is not safe and is not supported. We can go to the next slide. So this is a picture of our Journey Center, just one of the areas where people come and have psychedelic medicine experiences. And you can see that we really feel like it's important to have a window where you can see trees and see nature, and we have plants inside, and it's a very comfortable environment. We have koshi bells, and there's sage and Palo Santo, and we really create this lovely healing container for the person to have their medicine experience. We can go to the next slide. So this is a group ceremony space. This is actually my home. And so a lot of people do group psychedelic ceremony, whether that's with ketamine or other medicines. And group ceremonies are a way that people can heal in community and be witnessed and witnessed others. And we feel like that is a really lovely way to have a therapeutic medicine journey, and also can be a more cost-effective way for people to experience these medicines. And again, a lot of this is about not just the container in which you're held, but the people who are holding the space for you. Like, who are you sitting with? What have they done in their past? And we'll talk about that more in a little bit. We can go to the next slide. So intention setting is really important also in psychedelic journeys. There's not one psychedelic medicine where people don't or aren't recommended to set an intention. So I actually never even looked up the definition of intention before, but I think we all know number one, it's a thing intended as something like that. It's an aim or a plan, like something that we're striving for, that we want from this experience. But then I thought it was so interesting to see the second definition when we're talking about it in the context of medicine. And it says in the dictionary, it's the healing process of a wound. So I really feel like it is, right? It is part of that process of healing that wound that we have, and really talking about, what we think it is, and that we would like to address that thing, or we want to have a broad intention and go into this experience just being open and going with the flow, and allowing the medicine to really show us where we need to go. We can go to the next slide. So how do psychedelics work in the treatment of trauma and subsequent mental health issues? So these are the top three things that I think are really important. And then we'll go into what a medical journal says. But these are the three things that I think are critical. And that's connection with the inner healing intelligence, dissolution of the default mode network, and neuroplasticity. And we can go to the next slide and talk about the inner healing intelligence. So the inner healing intelligence is not something that we learn about in medical school. And nor do people typically, I would say, learn about it in therapy school or any of the these higher level educations that we go through. And we're taking care of people, and no one's talking about this. And so we're learning about it now. And I don't think it's ever too late to learn about the inner healing intelligence. And the inner healing intelligence, or the inner healer, or the inner knowing, is our own innate ability to heal ourselves. It is that voice inside of us that knows. And most of us have lost connection with that inner healer. Most of us never even thought that it was something that existed. And some of us on this call may not even believe that that is a real thing. And until you take the time to reconnect with that, you're really probably not ever going to experience that. And it really takes time to foster that connection back to that inner healer. But it's there. We can go to the next slide. So the default mode network is basically multiple places in the brain that are connecting with each other. And it's really most active when a person is not focused on the outside world. And the brain is kind of in this wakeful rest or daydreaming state, mind wandering state. And it can also be active during detailed thoughts related to external task performances. But it's active really when it can also be active when an individual is really thinking about others, thinking about themselves, remembering the past, planning for the future. And psychedelics are thought to kind of go in and disrupt this default mode network. And they really can, what we think they do is that it's the more psychedelic medicine you take, the larger we feel like this default mode network is going to be disrupted. But it's like it resets this default mode network. And they've done imaging studies on people on various psychedelics like LSD and psilocybin, and it shows a reduction in this default mode network connectivity. And there's also an idea that this is somehow related to what we call an ego dissolution, where an ego dissolution is something that can happen on psychedelic medicines. It doesn't always happen, and it's typically when someone has a certain dose of a particular medicine, where you lose connection with your sense of self. And that's something that any psychedelic medicine provider should tell you about that could potentially happen on psychedelics. And because an ego dissolution can be very scary, especially if you weren't aware of the possibility. But it can also be the most amazing experience of your entire life. Right. So an ego dissolution can be where you all of a sudden feel like you're going crazy and you think you have schizophrenia and you're shouting out, I'm going crazy. I'm losing my mind. What's happening? Who am I? Where am I? Do I have a family? And then an ego dissolution can also be, like I said, the most beautiful experience of someone's life where they are a star in the sky, totally disconnected from everything and everyone and feel amazing about it. So, the role of an ego dissolution in a psychedelic medicine experience is something that a lot of people are paying attention to and researching. And it's an important part of psychedelic medicine. We can go to the next slide and talk about neuroplasticity, which I love this picture. So this is a picture from a study, and this is just a graphic demonstration on neuroplasticity is basically new growth in between neurons and allowing connections in your brain to happen that wouldn't that either were damaged from before and they're regrowing, or it's a totally new connection. And so on the left, you can see this is placebo. This is basically how your brain is typically, what's connecting in your brain. And then on the other side, it's someone on psilocybin. And so you can see that there are so many more connections going on from different parts of the brain that weren't otherwise communicating. We can go to the next slide. So when you're interested in psychedelic medicine, a lot of people say, well, what should I do? How do I know which one to do? And it depends on a lot of different factors, and probably more factors than I have listed here. But the first one is legal landscape, right? Are you someone who wants to have an experience that is totally above board and you will only do an experience of something that is prescribed by a doctor? There are many people who go down that route, and there's nothing wrong with that. There are some people who like to operate in other places where they are willing to go to underground providers, or they're willing to leave the country because it's illegal here and go somewhere where it's legal. So that is a big factor. And in terms of, do you have someone that you can reach out to, a provider, not necessarily a provider of medicine, but your therapist or someone that that can maybe help guide you, because that's an important person to have. And really, what are you struggling with, right? Because if someone has suicidality, many people would say, well, don't do other medicines besides ketamine. Ketamine is probably what you should do. I mean, if you're looking at psychedelics, right, there's other options for people with suicidality like TMS and ECT, but ketamine is a really wonderful option for people. Or you're struggling with PTSD. Are you, there's a lot of, do you have an opiate addiction, right? And so for us in psychedelic medicine, it really depends on what you are struggling with that we could kind of help guide you in one direction. Do you have any medicals or psychiatric contraindications? And that's an important part of this, right? Some people can't experience certain medicines because they had a surgery on their esophagus or something like that. Like there's some particular things to know about these medicines. And then that inner healing intelligence and that inner knowing and that call. Are you called to a particular medicine? Some people will say 100% I am called to this medicine and not another. Are you someone who prefers all natural medicines like fungal medicines, plant medicines, or do you prefer pharmaceuticals because you feel like they've been tested and you trust in your doctor? And like I was talking about before, do you prefer to stay here in the United States, or are you interested in going abroad and having a more indigenous medicine experience, right? Do you want to drink ayahuasca in Boulder or in Denver, or do you want to go down to Colombia? So there are benefits to all of those different things and disadvantages to some different options also. Cost is also a thing that's not on here. We can go to the next part.
Dana. Hey,
Yeah.
Dana, I'm so sorry to interrupt. But we only have
Yeah.
10 minutes left.
Oh, wow.
And
We really,
so,
that was
yeah,
a lot.
yeah.
Okay.
So,
Let me just share one thing. So, I want to do the Q&A, but I wanted to also say that there's just a few slides in here that are summarizing research for, they're abstracts basically of the research that's been done in the eating disorder area. So if anyone wants to access that, I wanted to provide that to you guys just so you have that information. There's not a lot of studies on it, but there definitely has been, and there's more that are coming. So we can easily give you guys that information.
I'm wondering, do we have time maybe to talk for a few minutes about that piece and then move into the Q&A? And if we go 5 minutes over or something, that's okay. Just, I think people would love to hear just a few minutes about that from you.
Yeah, so we're gonna have to advance the slides a little.
Okay.
I'll let you know. We can just keep going. I have so many great things. Can we just make this 2 hours?
We can do a part 2.
We can also share the PowerPoint. I mean, I'm happy to share the PowerPoint with people.
Okay. If you're okay with that, then
Yeah.
once we can talk offline, but if I have your permission, then we can send it out to everyone.
Totally okay with that.
Okay.
and also anyone can reach out to me. I've put my email in the chat, and we can always schedule some time to talk. I'll answer questions. Because I just want to make sure that everyone who's here is getting an opportunity to, get their questions answered.
Perfect. Thank you.
Great, awesome. So this first one is really just a case report. This was the first time it was mentioned in the literature, and it was in 1959, and it was just a single case report of a woman with anorexia. She was 35 years old, and it really just gave this detailed information on using psilocybin for her in the treatment of her anorexia. And it noted that they had given her 2 doses of intravenous doses of this medicine, and that she was noted to have definitive recovery with mention of improvement in mood, but there weren't any further details on improvements in restriction or weight that were noted. But this is one initial case report. I just really wanted to kind of summarize what was out there. We can go to the next slide. So this is Adele. I don't know how many of you know Adele LaFrance, but she's an amazing woman and friend of mine and does a lot of research in this space. And she published this paper on qualitative evidence for the utility of ayahuasca in reducing symptoms of eating disorders. So they looked at 16 people with self-reported history of eating disorders who underwent semi-structured interviews on experiences with ceremonial ayahuasca drinking. And the themes included reduction or cessation of disordered eating behaviors and shifts in body image perception. And they have found that 69% reported some decrease in symptom severity, and half reported reductions in comorbid anxiety, depression, or substance abuse. One of the people had brief symptom exacerbation, but then that shortly was followed up by improvement. And this is just, summaries of the other studies. There's probably 2 or 3 more. I can read through them if you guys want. I think it would be better if we did the Q&A. This is just another smaller study. They're all small. And so one of the take homes here is that we need more research. We need more data. A lot of people would feel better about having more data to support something that they're going to do for treatment of something, or as a provider or prescriber. But the reality in a lot of this is that a lot of people don't have time to wait for evidence-based medicine to come out with all of this information. A lot of people are really struggling and are critically ill. And so first, it's like in the addiction space, right? We have people who are addicted to opiates, and we fly them down to Brazil and give them Ibogaine because we know that it is really helpful. And then we know the alternatives are not. So that's really the end of the talk. So I just, I'll give you guys all of the information. Just quickly, I kind of wanted to say what we do at Skylight. So at Skylight, we prescribe ketamine to be used in a therapist office, a licensed and trained therapist office. There doesn't need to be a doctor present because it's a sublingual dose of ketamine. And we train the therapists as well. So we train therapists with an online self-paced platform that's affordable comparatively to all the other training programs that are out there. The one that I took was really cost prohibitive for a lot of people.